Baby teeth start to grow from around 4 months of age. However, some may take longer, and this should not be an issue because babies are different. A full set consists 20 teeth once they are fully grown. Dr. Davis Ntulume, the head of the dental department at Nakasero Hospital, says your infant is ready for a dental visit as soon as the first teeth start to appear in the mouth.
Sometimes children are born with teeth. We call them prenatal teeth. They are not exactly the same type of teeth as you would find in a child who is in a toddler, I would say, but remnants of the developing tooth buds that are found in the mouth. And they have a whole branch of how locally people manage them. But also medically, if you came to the hospital, there are ways in which we handle this. If that is a concern, usually it causes trauma when the baby is breastfeeding. And that tooth is going to scratch the nipple, and it is uncomfortable for the mother. So when that happens, we always advise the parents to seek the opinion of their dentist or the pediatrician who will refer you to the dentist. So the first visit is never aggressive, not too much work is done. It's to check up the status and see the baseline. Are the parents looking after the teeth very well? Has the child been introduced to brushing? Is there any decay already? And to encourage the parents especially to improve where there are problems, but also to learn new techniques of how to care for the baby's teeth.
Children have the advantage to keep their primary teeth for longer simply because of their non-sugary diet. But when sugar is introduced, they risk decay.
So if you're going to make porridge, if you're going to make milk, if you want to make those juices for the children, try not to include sugar as much as possible. Sugar is the biggest culprit to causing tooth decay in children. And from experience, as parents, we all know that brushing babies' teeth is very, very difficult. The cooperation is not there. So if the diet includes sugars, things like sweets, cakes, biscuits, very early, and yet your child does not allow to brush, then definitely you're going to get decay of the baby's teeth. The other biggest cause of decay of baby's teeth are the syrups that we have to give to the children. It is common that children fall sick, and when they fall sick, because they can't comfortably take tablets, we give them the syrups. So syrups have a necessary reason why we give them to the children. Therefore, treating of infections, of all other illnesses the child might have. However, they contain a lot of sugar because we want to make them palatable. We have to make them agreeable for the child to take the medicine. So when that sugar is not promptly removed from the teeth, that is another big source of decay in children. The other common cause of decay in children's teeth is the feeding bottle. Most parents' habits is when a child is going to sleep, we give them a bottle to make it easy for them to sleep. The problem is what we put in the bottle. So some parents are putting in soda, some people are putting in juice. Sometimes it's the milk with the sugar sometimes. And so the baby sleeps with that. But the baby is not brushing like he would regularly. So whenever sugar remains in the mouth longer than it should, then we are going to have tooth decay.
Dr. Ntulume says at 1 year, it is ideal for you to have your child examined by a dentist, and here is why.
The reason is the dentist is able to identify if decay is starting to happen, and they help to advise you, the parent, on what to do to avoid full-blown decay of the child's teeth. If it's the syrups, we shall help to advise you what to do about it, but the purpose is for the dentist to identify caries when it is just developing so that we don't lose the primary teeth before they are ready to come out.
He also explains when you should introduce toothpaste to your child.
Toothpaste is introduced as soon as the child learns how to spit. The idea is we want to control how much fluoride the child ingests, because when you give them to brush, they usually just swallow everything. So once they learn how to spit, we start introducing toothpaste, and we always begin with very small amounts of toothpaste, which even if they swallowed, we know it's not going to cause a problem. And then when you're sure that the child is now very good at spitting, then we can step up the quantities, we can step up the brushing. But brushing for children is always supervised. Children learn by mimicking. They watch what they see is what they do. So you teach them actively. You show them how to brush. There are toothbrushes meant for children. They have smaller heads. They are called pediatric brushes. It fits easier into a child's small mouth. So when we are introducing brushing to the children, we start with a toothbrush without toothpaste on it. We always encourage the parents to do. If you have to give the syrups, if you have to give whatever it has some sugar in it, add plain water after. The idea is you want to wash the sugar off the teeth as soon as possible. Where there's sugar, there's going to be decay. If you remove the sugar, you're delaying the delay process. So in introducing water to wash the sugar off the teeth, you are helping to decrease the risk of decay in the children's teeth. The other thing that parents do is you can get a soft cloth and physically clean the tooth one at a time when they are still few. There is indeed toothpaste that is designed for children. The differences between children's toothpaste and adult toothpaste comes down especially to the quantity of fluoride in the toothpaste. So kids' toothpaste have a lower fluoride content compared to adult toothpaste. And still, even when we use children's toothpaste, we are going to use smaller quantities because we know children will swallow it. But as soon as the children master how to spit, we want to switch to adult toothpaste. We don't stay too long on the children's toothpaste.
Healthy teeth are important to a baby's overall health. They help the baby eat and form sounds and words. They also affect the way your baby's jaw grows. Walter Mwesije, NTV.